But as of this morning, we have 136 patients. 54 are in our ICUs. 13 of the 54 are on ventilators. We admitted 22 patients in the last 24 hours, but we also discharged 15 patients healthy into home in the last 24 hours, 15 patients discharged. The average length of stay for a patient in a med-surg COVID unit, not in the ICU, is 5.5 days. The average length of stay for a patient in our ICUs is a little over 14 days. 85% of our patients are unvaccinated right now. The 15% that are vaccinated, and this is really tricky, and I know that this entire pandemic is complicated, it can get confusing, and quite frankly, it can be anxiety-provoking to those that are not close to it. When they look at this and they think, wow, there's a lot of vaccinated patients coming into the hospital and being admitted, people have to realize that the vast majority of the 15% of the vaccinated patients that we're caring for, and we're a microcosm of what's happening across the state, and I would submit to you probably across the country, are patients that are already immunosuppressed. And those patients are transplant patients, they're cancer patients, they're individuals that have been vaccinated, didn't have the response to the vaccine that maybe you and I might have had. Then they get COVID, no fault of their own, and then they get sick, and they end up in an institution like Tampa General Hospital because we're an institution that tends to take care of the sickest and most complex patients in the region. So most of these patients are those types of individuals. And then the balance are older patients, people that are in their 70s and 80s, and even in their 90s that have comorbid conditions. And I think it's very important for the public to understand that.